can launch right now. I'm just hitting record and I'm going to start the transcript. So go right ahead.
All right. Well, welcome everybody. This is a fun thing to do to get together, and we appreciate you coming on board. My name is Alan Ormsby. I'm the state director for AARP here in Utah, and I want to thank you for joining our AARP Utah University webinar on the psychology of pain. According to the CDC, that's the Centers for Disease Control and Prevention, roughly 60 million Americans deal with chronic pain. Chronic pain or pain that restricts life or work activities is the most common reason adults seek medical care. So I'm glad you're here with us today. I'm sorry if you're feeling pain, but hopefully, as we learn more about chronic pain through psychological and emotional lenses, it will really help. So before we begin, let's take a few quick polls. You should see the first poll question pop up on your screen.
And I will get to that. Hold on a second. Let me get to the right stuff here
No
because
problem.
I do have a poll. Polls. There we go. So let's launch the first one.
All right. Poll number one, and you can click right on here. If you, we want to know, how did you hear about this webinar? This is really important for us to be able to figure out the best ways to send out information. So, did you receive something in the mail? Did you receive an email? Did you see the class posted on social media? Did you hear about it from a friend? And did you hear about it in some other way? If you heard about it in some other way, would you pop into the chat and tell us how you heard about it? We're really curious if you heard about it on the radio. We, for the first time, did some radio advertising, and so we're really curious to hear if you heard about it on the radio. So thank you. It looks like Barbara says the virtual community center. Lily says the website. Awesome. These are great. Gal, thank you so much. This is just so helpful for us to be able to know how to do this outreach and make sure that we're reaching people in the best possible way. All right. So the results, I think everybody can see those results on screen. It looks like for the most part, people received an email, about half of you. And about 26% heard about it in some other way, virtual community center, checking the events lineup on your website. Lisa, thank you. We appreciate that. So, yes, thank you all for the fine responses. I appreciate that very much. We'll have a couple of other polls here in a second. So, let's take a look at our second poll, which should now be popping up on your screen. And this one gets to our specific um, topic of the night. So, Darren, I don't know if you can
There we
close
go.
that first poll. There we go. I can see it. Awesome. Okay, which of these choices best describes how chronic pain affects your daily life? Does it affect your mood and your emotions more than people realize? Does it limit what you can do physically day by day? Does it impact both your physical and emotional well-being, or is it all of the above? And I'm seeing already all of the above seems to be the clear winner, affecting your mood, limiting what you can do physically, or it impacts both your physical and emotional well-being, or all of the above. Yeah, it's a pretty challenging thing to deal with. Pain can really be very, very difficult. So thank you again for participating in the poll. Before we get started, I want to mention a few housekeeping items. We're going to get to all your questions at the end of the presentation. Hopefully, we'll have time to get to all of them. So if you do have a question at any time, put it in the chat box and we'll go through them at the end. Darren will be compiling them as we go. So definitely don't hesitate to put your question in. And as one last note, we will be recording this event and it will be available on demand on our YouTube account. We're also going to send you a link in a follow-up email tomorrow morning, along with an important survey that we hope you'll take a minute to complete. So, all right, let's get started. Joining us tonight is Dr. Randy Gilliland. He is a clinical psychologist at Utah Valley Pain Management. He is conducting psychological evaluations and provides evidence-based psychotherapy for adults dealing with chronic pain, anxiety, depression, PTSD, and insomnia. So, Randy, welcome. We want to thank you for joining us today. And before you get started, we want to ask just one more poll question to help our attendees get us all to let us know a little bit more about their lives. So, poll number 3, that question has to do again with chronic pain. And we'll wait for just a second for it to pop up. What is the hardest part of living with chronic pain? Is it helping people understand what's going on in your life? Is it managing the stress, frustration, or hopelessness? Is it feeling believed or being taken seriously? Is it knowing how to cope or where to turn for help? So, again, what's the hardest part of living with chronic pain? Is it helping others understand? Is it managing the stress, frustration, and hopelessness? Is it feeling believed or being taken seriously, or knowing how to cope or where to turn for help? Looks like knowing how to cope or where to turn for help is leading, with around 60% of folks saying that. That is hard. So, Dr. Gilliland, what do you think of these poll results?
Well, these are fairly typical of the people I see on a day-to-day basis.
Well, thank you again for your expertise. I'm going to go ahead and turn it over to you for the remainder of the time. And remember, for our listeners, if you have any questions for Dr. Gilliland, be sure to drop them in the chat and we'll get them toward the end of the presentation. So, Randy, go right ahead.
Okay, so I'm just trying to get to share my slides. Yeah.
Okay, it looks like it says that you've started screen sharing and now we can see your slides.
So if you just want to put it in presentation mode now, there you go.
You see it now. Okay.
Yes.
I'm
Awesome.
happy. Like the poll showed, the people I meet with on a day-to-day basis are dealing with a lot, and happy to be with you tonight and share some information. I hope that it can be helpful. Um, with chronic pain, it's never a one size fits all approach. And so I hope each of you can take some things from what I share today to apply, but also have some things to do, perhaps some things to look into. I would invite each of you to have something to write with and be thinking about your individual experience with pain and um, what are the things that we discuss are showing up in your life. And because I'm guessing it's not just going to be one single source that you look for help. Um, the best chronic pain clinics and the best outcomes we get come from an interdisciplinary approach where you're working with a physician, a physical therapist, a mental health provider, and other disciplines as well, a dietitian. Um, and so it takes a lot of different disciplines to address all of the concerns that people bring in. And so I'm assuming that that's going to be the case for you as well, and that's okay. Um, Additionally, my hope is to broaden your perspective of what pain is and what you can do about it. and in that find greater hope that you can um, have options and have things that you can do. What I want you to really take from this is that pain is real. And so even if you look whole, you look healthy, you're not, um, even if that's the case, or if other people dismiss or discount what you're experiencing, if you're experiencing pain, it's real. Pain is influenced by the body, what's happening in the body, by what's happening in our mind, as well as what's happening around us in our environment. It's a complex interaction of these factors, and because of that, I want you to be considering how pain, what factors are at play in your pain experience, so you can be looking for ways to address each of those concerns. Lastly, because of that, because there's a lot of factors that contribute to pain, there are a lot of ways that we can help you reduce suffering and help you live a meaningful life, even if that life involves pain. What I'm going to be covering tonight, I want to review our current understanding of pain and chronic pain to help you give you an understanding of what's happening within your body. I'm going to talk about common co-occurring challenges that people with chronic pain experience. And then lastly, I'm going to review the current mental health treatments and coping skills for chronic pain. And I also have a couple slides with resources that I hope you're able to utilize. So what is pain? I want to start out by talking about our old view of pain. So in the past, we used to believe that pain and tissue damage went hand in hand, or there was this perfect correlation between pain and tissue damage. So if there's no pain at all, then there shouldn't be any damage occurring in your body. And if you're experiencing a lot of pain, then there should be a lot of damage in your body. And unfortunately, this belief still has hung around, both within the medical system and outside the medical system. And the consequences of this belief, there's a lot of them, but if a medical provider buys into this belief, it would be easy for them to dismiss someone that doesn't really have any clear indication of where the pain's coming from, and yet they're experiencing pain. It can also, if someone like some of you that are attending this that are in chronic pain, if someone experiencing chronic pain believes this, that there should be great damage or a lot of problems in my body if I'm experiencing a lot of pain, there are a lot of consequences there too, where they could either, if there isn't anything, if a scan, if an exam doesn't show anything, it could lead a patient to believe, oh, there must not be anything wrong with me, or this must be all in my head, or I must be making this up. This also could lead to someone going from doctor to doctor to doctor to try to find a clear answer, a clear diagnosis for what's happening. And it's part of the challenge when conditions become chronic, is that it becomes a little bit more fuzzy to get a really clear diagnosis as to what's happening. So this is our old view of pain, that there's this perfect correlation between pain and tissue damage. And I want you to consider, and you're welcome to put in the chat, any experiences or conditions that conflict with this belief, or this belief that pain and tissue damage go hand in hand. I'll start with one. So my next slide, this is an experience that was published in the medical journal in the 90s. A very popular story. So if you've attended another pain presentation, this may have come up, but as a construction worker in the 90s, jumped down from some scaffolding and felt something in his foot. And he looked down and he saw this giant nail sticking out of his boot. Immediately experienced intense pain, was taken to the hospital. They administered pain medication. They had to increase the dose until his pain reduced, so they could finally pull the nail out and get his boot off. And after they did that and they examined his foot, there was no injury. And what they found was that the nail went right between his toes. So what happened? And also, was his pain real or not, even if there wasn't any damage? So what is pain? If pain can occur in this instance without damage happening in the body, what is pain? So just a practical definition of pain is all about protection. Pain is trying to protect the body from actual or potential damage. Pain occurs when the body perceives that protection is needed. Also, pain can be present with or without tissue damage. So, physiologically, what's happening when someone is experiencing pain? So, our body is full of nerves that provide us information as to what's happening. Um, and the nerves that respond and help us perceive threat are called nociceptors. And those nerves, again, are throughout our body. They respond to physical, to chemical, thermal, and mechanical information. And just as an example, let's say that this person here, this diagram, that he stubbed his toe. And so what happens is the nociceptor picks up on that. That's a physical stimulus, or that's a mechanical stimulus, stubbing your toe. That signal then gets sent to the spinal cord. The spinal cord then sends that signal up to the brain, where this signal is processed. This accounts for the brain then accounts for what's happening in the body, how severe was it, what's happening around me. So the brain takes into account all available information, including the person's history, including what might happen in the future, in the current scenario. Um, and then the brain makes a decision as to whether or not pain is needed in order to protect the body. Um, there are instances like that nail in the boot example. There's instances of pain without damage. There's also instances of great damage without pain. We think of examples of soldiers on the battlefield getting shot, but not feeling it. And in that instance, we can theorize that the brain has decided that the most important thing is that I get to safety, that I get out of this place where I'm being shot at. And so at that point, protection of the wound isn't necessarily important. The most important thing is to survive and get to safety. And so in that instance, the brain decides that pain isn't important. So these reports that we hear of soldiers on the battlefield sustaining great injury but not experiencing pain, like that's why. It's because pain is all about protection. And if protection is needed or warranted, then the body produces pain. So where is pain coming from in the body, or what are the sources of pain? So nociceptive pain is pain due to activities in the nerves that's secondary to actual or potential tissue damage. So that example of the guy with the nail in his foot, or not in his foot, but the nail between his toes, that would be a nociceptive type of pain. There wasn't damage there, but the pain was related to potential tissue damage. There's neuropathic pain, which is due to nerve damage or disease. And then there's nociplastic or central sensitization pain. And that's due to changes in the nervous system that cause abnormal pain processing in the body. What's interesting about pain, what's actually tricky about pain, is that over time, let's say someone starts with a nociceptive type pain or a neuropathic type pain, over time, as those signals fire over and over again, that signal can then turn into a nociplastic or central sensitization type pain. Some indications that that's happened, or hallmarks of central sensitization, are fatigue, memory or attention difficulties, hypersensitivity to environmental stimuli. So if like lights, sounds, touch, if someone is overly sensitive to that stimuli. And then lastly, kind of emotional dysregulation if someone is highly anxious or highly depressed because of their pain. Those could be signs that pain has become a central nervous system issue instead of just a nerve or a nociceptive issue. And the hope here, what I find hopeful about this is that this broadens what we can do about pain. Also, I highlight this just for you to explore. Yeah, I wonder where my pain might be coming from in my body, because each of these types of pain requires different treatments. So, because pain plays on our nervous system, we take a biopsychosocial approach to working with pain. As a psychologist, my job is to explore the biopsychosocial factors that might be contributing to someone's pain condition, and specifically addressing the psychosocial factors. But I'm going to be talking about each of those three. So biologically, these are some of the factors that could be contributing to our pain experience. And like I mentioned before, I invite each of you to consider, what are the specific biopsychosocial factors that might be contributing to my pain or at play in my body that are influencing my pain. There are a lot of studies that highlight the relationship between sleep and pain, as well as the connection. There's a large body of research supporting the relationship between exercise and pain. What we find is people with chronic pain, because movement activity can be difficult, part of what we encourage is for people to find what they can do physically, and starting there, even if it's something really, really small. But exercise can reduce pain. If you're finding that pain or that exercise is increasing your pain, perhaps scaling back and finding something even smaller that you can do in terms of activity. With chronic pain, what we look for is consistency, helping people find something at their level that they can be consistent with, whether it be walking, whether it be some kind of seated exercise. If you're having difficulty finding that, I would encourage you to meet with a physical therapist to kind of find what you can do. The phrase that we often use is motion is lotion. We want people with pain to be as active as they can because it's good for the body and good for the mind. In terms of psychological factors that play out, our thoughts and beliefs show up and affect how we experience our body. There's a really interesting study that came out a couple years ago, where they surveyed people who had undergone surgery for cancer to cut out precancerous tumors. And those after the surgery, those who had attributed the post-surgical pain to returning cancer experienced their pain as much more severe and much more distressing than those who attributed the post-surgical pain just to the healing processes of the body. And so what we attribute our pain to can affect how we respond to it or how we experience it. Lastly is social. So these are some factors in our social lives, our relationships, our level of social support, the demands that are placed on us in our roles or at work, as well as cultural expectations, can play out in how we experience our body and how we experience our pain. Again, there's a large literature of research supporting the connection between relationships and pain and how someone experiences pain. And what they find, or what's consistent there, is the quality of the relationship can improve someone's ability to function and cope with their pain. And so it has an effect. And if pain were all about the tissues of our body, then that wouldn't play a part. The quality of my relationships wouldn't really play a part if the pain was all about what's happening inside my body. And so I'd like each of you to just consider, how's this showing up for me? Could I work on improving my sleep or work on what I'm thinking about my pain, what I'm anticipating related to my pain, or could I work on improving the quality of the social support that I experience? Some things that you can consider or explore, things going on inside of your body, how I'm experiencing the different experiences in my body, whether it be kind of something that sounds a certain way or something that feels a certain way, how I'm reacting to the things that are occurring in my body, things going on around your body. So, what environments I'm in, the things that you do, activities that you engage in, how did these things play out in my pain? Do some things make my pain better? Do some things make my pain worse? Places you go, are there environments that make your pain worse or make your pain better? How does your pain feel when you're in an environment that feels safe and secure versus an environment that feels unsafe and hectic? Does that change how you experience the pain in your body? People in your life, are there relationships that um, help you feel supported? And maybe when you're around those people, maybe you don't notice it as much. Are there other relationships where maybe you're a bit more stressful and you notice it a bit more? Your own thoughts, feelings, beliefs, and expectations, how those are playing out. And within each of these, I invite you to consider, are there things that, again, make my pain worse or make my pain better? I presented this to someone several years ago who was quite skeptical, and mentioned, my pain is all the time. This person had back pain and just said it's constant, it never goes away. So I shared this with this person and I said, yeah, this is your homework. I want you to consider all of the different kind of aspects of your life and what things make pain worse, what things seem to make pain a little bit better. And this person came back and said, it was eye-opening. I didn't realize it until doing this, but when I'm around my boyfriend, my pain goes down. I'm not even noticing it. And that was really eye-opening for this person. And so just something I invite you to do. What are some factors that might be contributing or playing into my pain experience? Lastly, are things you see, hear, smell, taste, or touch? Are there things that I have these kinds of sensory experiences with that increase my pain? Are there things that decrease my pain? So what are some common co-occurring challenges that people with chronic pain report? These are the common mental health disorders or diagnoses that are often reported in the research literature, and I would say my clinical experience confirms this. If you're seeing this list and if you're saying to yourself, well, I've got one or several of these conditions, I hope that you don't take from this, oh, that means that I'm so bad off or anything like that. For me, I see this as hopeful that, hey, if you've got pain in conjunction with one of these conditions, I do wonder if we address the mental health condition. And I'm sure there's some overlap in terms of the pain and the condition interact. And I wonder if we address the depression or if we address the anxiety, how that will impact your quality of life. I've worked with people where we've addressed the mental health condition and their pain has dropped down as their nervous system settles. I've worked with other people where we've addressed the mental health condition and the mental health condition goes down, but the pain remains. But what they find is now that I'm not dealing with depression or now that I'm not dealing with clinical anxiety, I still have this pain, but you know what? It's kind of freed me up. I've got more capacity to live my life in a meaningful way, even though the pain didn't change. And so if you have one of these conditions, I would invite you to find a mental health professional and work with a mental health professional to address the condition. And I'm confident, I don't know how it will play out for you, but I'm confident that it will give you some form of benefit. What are some other common challenges that people with chronic pain report? Scroll too fast. So first off is loss of identity. So previously I was able to do this, and I can't do it anymore. And I just don't know who I am anymore. Or previously I went to all my grandkids' sporting events, and now I can't sit in the bleachers that long. So I don't know who I am anymore as a grandpa or as a grandma. Functional changes. I used to be able to do all of these things and I can't now. And so I'm frustrated about that, understandably. Feeling judged or doubted by others, by medical professionals, by friends, by family members. And that can be quite painful. Difficulty making and keeping commitments. If your pain fluctuates day to day, it can be difficult to make a commitment for tomorrow when you don't know what tomorrow's going to be like, or if a storm's going to come through. And so there was an interesting study a couple years ago looking at this and how people with chronic pain deal with having to break commitments. And they found that people that were higher in self-compassion, so the ability to be compassionate and loving towards yourself, were much better at being able to weather this challenge and still being able to be as engaged as they could in life, but also kind of deal with having to break commitments. And so, if that's something that you um, deal with or struggle with, is the emotional turmoil of having to break commitments, I'd invite you to look into self-compassion. There's a really great website, self-compassion.org, that has lots of resources. Pain catastrophizing, which is a focus on the worst case scenario. Pain catastrophizing is actually the best predictor of back pain 1 year after the onset of back pain. And so, how I'm responding to or reacting to my pain can influence whether or not my pain is going to be around. Not in all cases, but perhaps something to consider. Yeah, I wonder how my reactions to this are playing out in my pain experience. Difficulty distinguishing between thoughts, emotions, and pain, where just everything feels painful or stressful. Partly this occurs because pain is a distressing stimulus in the body. And so some people I work with tend to deal with pain by distraction. And distraction can be helpful, but used in excess, you stop connecting to other signals of your body. And so something that we often work with people on are working to distinguish what's a thought, what's an emotion, what's pain, or what's other signals in the body, learning to distinguish those. And as we do that, things kind of settle down a bit. The nervous system feels a bit more safe when we're able to identify our different experiences in our body. Also, as we identify the different experiences, we know which ones we can regulate and which ones we can't. And so it helps us kind of distinguish and be able to cope better as we're able to identify what's happening in the body. Difficulty pacing activities. And so some people with chronic pain that I work with, on days that they feel good, they want to do as much as they can, and then they flare up and then they're down for a couple days. Or they get frustrated with their pain, and so they want to push through and they want to do as much as they can, and then they flare up. And so if this is a struggle for you, I'd invite you to meet with a physical therapist and find, what can I do? What so I can learn to kind of pace my activity in a way that isn't going to flare up my pain. Lastly, something I commonly see are anxious breathing patterns, people kind of breathing with the chest, people holding their breath. Um, and I'll talk a little bit later about slowing the breath down. But if that's something that you do, that's something I would encourage you to kind of pay attention. Am I breathing shallow? Am I breathing quickly? Do I hold my breath? Because that in itself is going to put the nervous system in a threatened state and can amplify or put your body in a hypervigilant state. And so working on slowing the breath down can help. So what psychotherapies are available for people with chronic pain, and what tools would I recommend starting with in terms of coping with your pain? So these are some of the current psychotherapies that are available for people with chronic pain. The most popular being cognitive behavioral therapy for chronic pain. I can go through each of these if, during the questions, if anyone wants me to kind of speak a bit more detailed about these treatments. But I just want to highlight that there are treatments available to address the emotional burden, the reactions to pain. And so there are options out there available. So I want to talk about a few basic coping skills, why they help, and maybe take a few moments to briefly practice each. So the first one is slow, extended breathing. And so what I would invite you to do right now is just notice how you're breathing, just kind of your regular pace of breathing, and just see if you can slow it down a little bit. See if you can extend it a little bit. Why this helps as we focus on our breath and just kind of slowing the breath down, one way that I would encourage people to breathe is just breathe in a way that you breathe when you're feeling safe. When we feel safe, breathing is a little slower. Our breathing is a little extended. We don't have to take a huge breath, but just slowing it down and extending it can help settle the nervous system down. And when I think about the nervous system, I like to think about the freeway that, you've got this one large freeway with all these cars, and our body, or like our pain, our emotions, our sensory experiences are all driving on that freeway. They're all driving on the same nervous system. And so if we can settle that down, it can change how we experience those different things, our pain, our emotions, our stress. And so I see the breath as kind of the first line coping skill for working with pain. So I'd invite you, if you've been able to do this, I'd invite you to just notice how it feels to just try to slow your breath down a little bit. Next, we have mindfulness practice. Mindfulness, there's a lot of different definitions out there. My favorite kind of basic definition of mindfulness is that first we're working on bringing attention to the present moment. Our minds can get caught up in the past. Our minds can get caught up in the future. And so with mindfulness, we're trying to be in the present moment, and we're trying to just notice what's here in the present moment in a non-judgmental way. So we're working to just observe and be with what we're experiencing in the present moment. So mindfulness practice helps increase a sense of safety in the body. As I'm able to sit with things in the present moment, they feel a little bit more safe compared to when I tack on my worries about the future or my regrets of the past. If I can just stay in the present moment, the things that I'm carrying feel a lot more carryable when I'm in the present moment with them. So if we want to practice a little bit of that right now, I would encourage you just to, we were noticing the breath earlier. If you could bring your attention to your nose or your mouth, wherever you're breathing from, or both. And as you breathe, I invite you to just let your attention rest on the sensation of your breath. And just notice as it flows in and as it flows out. That sensation is happening in the present moment. So just noticing and just observing that sensation. When I work with people with pain, when I work on mindfulness, I'll usually start with a sensation that is non-threatening for them. So the breath, maybe starting with sounds, or going outside on a sunny day and just feeling the sunlight on their skin. But starting with something that's non-threatening to practice being mindful of. And then we work towards being mindful of other things that might be more difficult, like difficult emotions or pain. Next is noticing and reframing thoughts and beliefs about pain. So I would just invite you to consider, what do I believe about my own pain? What thoughts do I have about my own pain? Do I believe that I'm broken? My body is ruined. Those would be things I would encourage you working with a therapist to reframe. As we work on identifying and reframing our beliefs, it reduces our emotional reactivity to our pain signals. Lastly, I would encourage you to find what you can engage in, finding enjoyable activities that maybe you've backed off from. In addition, finding exercise or physical activity that you can engage in. Some people I work with physical activity currently isn't possible for them because their pain is so high. And so I encourage them to just visualize. When we visualize doing an activity, it activates the same parts of the brain as if we're actually doing it. So what we're doing when we're engaging in that, either visualizing it or actually doing it, we're teaching the body that it's safe. It's safe to do these activities. Engaging in life and in activity can reduce symptoms of depression. It also teaches the nervous system that these activities are safe. And again, I would, if activity's been like a significant challenge, I'd work with a professional, a physical therapist, a medical provider, to find out what you can do, and from there develop a plan to stay consistent in engaging in that activity. So in these slides, these are going to be sent out, I just want to highlight at the top here and give a shout out to the Living Well with Chronic Pain classes. Those are run by the Utah Department of Health. They're free classes teaching pain coping skills. When you get the slides, if you click on that link, it'll lead you to see where these classes are held. I believe that they do have virtual options, depending on where you live in the state. Or I noticed that there are some people from outside of Utah, and so I'm not aware of this resource outside of Utah, but I would imagine it is. But there are some other resources in terms of learning about pain, and I would encourage you to learn about pain. Go a little bit deeper than what I shared. This tamethebeast.org website, as well as the YouTube video below it, are great starting resources. But teach yourself about pain and about the pain system of the body. And then I also included several mindfulness videos so you can practice from home. This top one is a really good one, where he talks about utilizing mindfulness for chronic pain and working to just be present with the distressing experience of pain. So that's what I've prepared. I'm happy to answer questions that have come up through the course of the presentation, and go the questions.
Well, Dr. Gilliland, thank you. This has been so interesting, and I've learned a lot. My wife suffers from chronic pain, and so it's been very interesting for me to hear all of the guidance and the good thoughts that you've given us. I'm going to just kind of walk through some of the questions that we've received, and if people want to ask more questions, don't hesitate to reach out. Barbara asked the question, what if we're still in pain past taking the prescription medication that's been prescribed? Like, she suggests that if you're taking the dosage of opioids, for example, she feels like the pain level never quite reaches or never quite matches the medicine given. Any guidance there?
I would find other trying to increase your dose on your own, especially with opioid medication, is not a good idea. I would number one, consult with your physician and let them know, hey, this is what's happening. And if you have a bad experience with that, I apologize. There are lots of pain providers in the state, so if you're having a bad experience with your provider, get a second opinion. Find other. I would kind of broaden your strategy from medication to finding other things. If in the course of the presentation you found things that are also at play, like if you have depression, if your sleep is struggling, anything like that, start to target some of those. If you feel like the quality of your relationships aren't that great, start to target that. Broaden your perspective, because I think we can kind of run into this ceiling a lot, or this limit a lot, when we're just looking for medications or procedures, and it makes sense. Like I would imagine pain limits you quite a bit and is affecting a lot of your life. but we need to broaden our perspective on what we can do about it. And so medications definitely are helpful, but we need to find other ways. And so I'd encourage you to consider how else this is playing out, and hopefully that helps.
Yeah, thank you. Linda asks the question, what's the best way to explain the type and the severity of the pain to medical professionals? She specifically says it hurts here or it hurts when I do blank. Doesn't seem to communicate that in a manner to get the help that she needs.
So they're not kind of providing an accurate diagnosis, or they're not providing the care. Um, and again, if you feel like your provider isn't responsive and working for you, I'd go find a second opinion somewhere. Just know that as you know, you're the consumer. It's as the consumer, the power's in your hands to get a second opinion, and get a third opinion if needed as well. Um, I hope that you're able to find a provider that listens and that um, offers you the care that you need. I also would um, seek other, types of specialties too, like physical therapy, um, as well, just to yeah, make sure that your concerns are being addressed. And so if you feel like your provider's kind of being dismissive, I would go get a second opinion.
Yeah. And what are the best types of doctors or practitioners, physical therapists? Can you kind of say who should you be going to if the pain is not being addressed well?
I mean, we get the best results with an interdisciplinary clinic. Um, and I know there are several out there. And so our clinic offers an interdisciplinary clinic where you're seen by a medical provider, physical therapy, as well as a mental health provider. I know the University of Utah, their clinic offers that same structure. I wish I knew the whole state. I don't. I know in Utah County, there's Summit as well that offers a similar approach. And so um, at the same time, there are excellent providers that practice outside of this interdisciplinary model. And so um, I would, you know, go for that initial meeting. And if you're not getting the care that you feel like you need, or the attention, or being taken seriously, yeah, go get a second opinion.
Yeah, that's great advice. Tana asks the question, will you talk about specific pain? She is mentioning excruciating lower back pain from disc issues. Chiropractic didn't help. She's not taking pain pills. It's been a year, and DR dittos her experience.
It's difficult to provide like clear, specific recommendations without um, a medical exam. That the benefit, like, and me not being a medical provider, like I want to make sure that things I don't recommend do more harm than good. But that's part of the benefit of psychological therapies, is that we're not moving you or anything like that. And so I would encourage you to explore, you know, mindfulness practice as a really non like risky way of working with your pain and your reactions to your pain. I'd be curious to see how you're responding to your pain experience. If there's depression or anxiety showing up, I'd be curious as well, like prior to doing something, like sitting up, standing up, or whatever kind of activity sets off the pain. I'd be curious about anticipation, like if I'm feeling some anticipatory anxiety about sitting up, standing up, and that's something that we often try to work on. Or fear of pain is something we work on, because if you're afraid of it before you stand up or something, your body's going to tense up. You're going to be hyper aware of that part of your body, and any kind of fluctuation in your pain, you're going to be that much more aware of, and it's going to be that much more intense. And so, um, I think mindfulness practice, is a great way to practice observing and just being with the pain. Um, Again, yeah, I wish I could provide more direct um, answers, but without that's the benefit of working in a clinic like this. I can kind of see what the physician's recommending, and if there is damage or something happening, like knowing that I'm not going to be encouraging people to do something that's going to make it worse physically. So I'd get a physical exam, and I would try to understand what can I do physically, what can I do, what can I not do physically. Find a good physical therapist and work with them on increasing your activity and trying to um, yeah, work it back into to living your life.
Yeah, DR asks the question too. He said, just kind of makes an observation here. He says the medical community tends to not listen, just being due to being older. They kind of pass it off as just being old. Your
They're
thoughts there?
fortunate, like yeah, it's an unfortunate, and I'm sorry. And I think as a patient, you really have to learn to advocate for yourself and you know, speak up. And if you're not being listened to, say, hey, like one of the things, and I'll tell you this, one of the things at Intermountain, they take patient ratings very seriously. And so if that's happening for you, find a way to provide that feedback in writing to the provider. Hey, I feel like I'm being dismissed because I'm older. Like, I would imagine wherever that's at should take that seriously. And if they're not, go somewhere else.
Yeah, and I can only imagine no doctor wants to be told, "Hey, you're not taking my pain seriously." And so I think speaking up makes a difference. Now, they may not have a perfect solution, I would imagine, but speaking up, and especially that idea of, well, you're just treating me this way because I'm older or because I'm a woman. That happens to my wife a lot, where she feels like sometimes people in the medical field will say, well, you know, and then they'll give her an excuse, and it feels like they're dismissing her a lot because, she's a woman and she's gotten really good at speaking up and saying, hey, wait a minute, take this seriously. So,
The comment back before about the back pain that's just kind of always there. Like I would really try to like we want you to become the expert of your own pain and explore what are some things that where I notice it increasing? Hey, are there any things happening where I notice it decrease? Maybe like if I slow my breath down, maybe if I when I'm around people I love, do I notice any changes? But I'd encourage you to be really curious about your pain and the factors that increase it or decrease it.
we've got time for probably a few more questions. We've got one that I think is fairly fast. Debbie asked, what is catastrophizing?
So catastrophizing is a focus on the worst case scenario. We have a pain catastrophizing scale. When I gave the presentation, I was in presenter mode, but I couldn't see my notes. Um, and so I was going off the top of my head. Let me just pull this up about catastrophizing. The pain catastrophizing scale breaks it down into three areas, and this might be helpful to like this kind of more detail. So first off is helplessness. So I get overwhelmed easily by my pain. Rumination, where I'm constantly just kind of thinking about it. Or third, magnification. Um, I worry that something serious may happen. Um, and the helplessness subscale is predictive or relates very highly with depression. So people that feel helpless in their pain. So that's something that we'll often target. Um, but um, another way I would say catastrophizing, it's a kind of a reaction above and beyond what we would expect. So like a very strong emotional reaction to pain.
Okay, thank you. A question is asked about marijuana. prescriptions are not helping. How about marijuana? Is that something that is good idea, bad idea? Give your thoughts there.
I'm a psychologist, so that's a bit outside of my lane. I would say just like from the patients I've interacted with, I've found people that I work with where it's really helpful. I've also found people that I work with where they've tried it, and what they say is, it doesn't really change my pain a whole lot, but what I find is that I care about it less. And then there's a third group that like often just kind of get high from it, like that I don't think it's very helpful for them, but they kind of check out. And I don't think that's very helpful in terms of um, just quality of life and being able to engage with life and having a meaningful life. And so if I would talk to your medical professional or find a clinic that offers it, a reputable clinic that offers it, have a discussion with them. I would be hesitant if someone is like really selling something hard. I would be skeptical. It, I would want my medical provider, if I'm considering a treatment, I would want my medical provider to say, "Hey, that's an option. Here are the pros. Here are the cons." Like, I would trust someone like that versus someone that is just selling one thing and everything is that one thing. So I wouldn't necessarily go to a clinic that's like just marijuana if I'd be skeptical that they're going to say yes even if it's not a good idea for me.
Is the same true for, say, acupuncture? Sandra asked the question, how effective can that be?
I don't know the data off the top of my head. I would say it's low risk. Um, um, that's as much as I can give. I don't know the data on it, but acupuncture is low risk. They're not doing something highly invasive, and so um, I don't think it could hurt if you find a place that's reputable.
I'll give you the last thought, but I want to share one last thought from Betty, who said the first question I asked a doctor was, "How is your bedside manner?" She said, "I think it surprised him, but also made him pay attention and take time with my concerns." Betty, I think that's kind of genius. So I'll give you, Dr. Gilliland, the last word, and then we'll wrap up.
And I just hope I really hope that you can have hope that um, you can find ways to manage this. And so I hope that you're able to explore, beyond just what we call a biomedical approach, where I'm just looking at medications or procedures, and we're broadening that to, hey, maybe if I work on improving my sleep or my relationships or my emotional reactions to this, that the quality of my life will improve. And so just the message I give all my patients, I don't know necessarily how this is going to help you, but I'm confident that it will.
Well, this has been great, and I appreciate your approach. I appreciate your thoughtfulness. I hope we were able to answer almost everyone's questions. If you have further questions, I apologize, but we really do value you. We value your feedback. We really like you guys being a part of this. On the slide prior, there was an opportunity to join us for our next series, and so I really hope you'll take the opportunity to enjoy a lot of these different seminars. And if you did enjoy it as much as we did, join us for our next one, which is technology for aging in place. And in that webinar, you're going to learn how home assistants, smart appliances, and wearables can save you time and money, help you manage your health conditions, and give you even greater peace of mind. So you can learn more at aarp.org/Utah webinars. And so once again, we want to give a big thank you to Dr. Randy Gilliland for helping us by giving us today's presentation. We want to thank all of you for attending, and I hope you all have a wonderful and hopefully pain-free night. Good night, everybody.
Good job, guys. Good job, Alan.
Thank you. That was great.
That was a good one, huh?